Tuberculosis is a disease that many people believe is completely curable, and in most cases, it is. But there's a growing concern that doctors across the world are warning us about. That is drug-resistant tuberculosis. This is a form of TB where the standard medicines no longer work effectively. What's even more concerning is that in many cases, drug resistance develops not because the disease is untreatable, but because treatment is not followed properly. On this World TB Day, we are bringing the awareness episode and talking to the experts to decode how we can eliminate TB from India and globally. And in this episode, we are going to talk about what drug-resistant TB really is, why it is rising, and why completing treatment is absolutely critical. And on MedGate Today TV Digital, we are joined by Dr. Sandeep Nayar, Principal Director and HOD, Chest and Respiratory Diseases at Mac Hospital, a leading expert in respiratory diseases. Doctor, thank you for joining us and giving the insight for the audience.
Thank you.
Before we get into some drug-resistant TB, sir, I would literally like to understand your journey. What led you to specialize in pulmonary medicine, and how has your experience been dealing with TB cases over the years?
So, I always wanted to become a doctor, and when I did my graduation from prestigious Maulana Azad Medical College, so I wanted to do specialization in more of a medical terms only, and towards surgical area, more towards some medical. And then, first I took my PG exam. I had an option either going for medicine or pulmonary medicine. Somehow I had always had an inclination towards respiratory problems. It always was a rise in India and all over the world. Again, from a very prestigious Vallabhbhai Patel Chest Institute from Delhi University. So I've been fortunate to, graduate as well as postgraduate from Delhi University itself. And then that's how I came to it. And of course, very good journey. Very soothing, comfortable journey from here, and a very satisfying journey.
Sir, you encounter patients every day. How frequently do you encounter drug-resistant TB cases?
This is very unfortunate that the drug-resistant TB is now being encountered now. Of course, being a specialist, you're always referred the patient who are having problems in getting treated. Simple tuberculosis, or I would say that susceptible tuberculosis are being taken care by most of my physician fellows. It's only when these people become difficult to treat, or those people who have got resistance of TB, that they are referred to us. So hence our, the drug-resistant TB is more, because most of them are referred to us by our fellow colleagues. But of course, we do see a lot of TB patients now, and among them, a lot of drug-resistant TB also. Mainly among those people who have been having treatment, who have been having this disease for the second time or the third time, rather than for the first time. The first time, the resistance is much less. Even if the prevalence you go is about 2 to 3%. But among the repeated tuberculosis who got relapse or the TB patient, it may go as high as 15 to 17%.
If we start with the basics, sir, what exactly is drug-resistant tuberculosis? Because many of us don't know what is it.
If you go, this tuberculosis is being, it is caused by a bacteria, Mycobacterium tuberculosis. And to kill this bacteria, we have a number of drugs. So the first line drug is something which we always give it to the patient at the first go. And they mainly they compile of 4 drugs: INH, rifampicin, pyrazinamide, and ethambutol. So these 4 drugs, if the patient is susceptible to it, so we can easily cure the patient, we easily control the patient, we easily kill the bacteria, and just in 6 months, the patient, most of the tuberculosis, the 6 months is good enough the medication to be given. But in case any of these drugs, the bacteria is not susceptible to either INH, rifampicin, pyrazinamide, or ethambutol, which is the primary or the first line drugs, then these bacteria, they don't get killed by these primary drugs, and then you have to go for a second line drug. So you have to, get the treatment modified. Now, if it is resistant to only one of these 4 drugs, we call it a monoresistant tuberculosis. It can be either to INH or rifampicin or pyrazinamide or ethambutol or any one drug. However, if to 2 main drugs, that is INH and rifampicin, which are the mainstay of the treatment, then it is known as a MDR or a multi-drug resistant. Because then your normal regime or the normal the treatment what you are going to give it, that will not cure the patient. Then you have to modify it accordingly. So can be monoresistant, either only one drug, is resistant to only one drug, but it can be MDR, multi-drug resistant. When INH and FMPC both are the ones, when the bacteria is resistant to them, then you can't give these two drugs, then you have to give a second line drug.
So you talked about MDR. There's one more term, XDR. What is XDR?
XDR even worse. It is extensive drug resistance.
Okay.
Like I told you, in MDR, it is resistant to two drugs. INH and rifampicin. But in XDR, in addition to these two drugs, it is also resistant to fluoroquinolone. That is a second line drug, basically.
Okay.
Or even a bedaquiline or a linezolid. So, if I can just try to explain it more about it. When a patient has a resistance to either INH, rifampicin, pyrazinamide, ethambutol, we tend to give a second line drugs. So these are the first line drugs. Among the second line drugs, we again divide into a different categories. I will not go into different class or categories, but in group A, if I talk about, there are three important drugs which must be given if you want to treat a MDR bacteria. But if the bug is resistant to any of the group A also. So group A contains three drugs: fluoroquinolone, bedaquiline, and linezolid. They are very important drugs to be given for the resistant bacteria.
Yes.
So if it is resistant to these drugs also, either along with fluoroquinolone, either a bedaquiline or a linezolid, then they are known as extensively drug resistant or extensive drug resistant, because these are very difficult to treat because you have lost the main drugs which can kill the bacteria. So you can't give fluoroquinolone. Fluoroquinolone is again commonest which we give it are the levofloxacin and the moxifloxacin. So you can't give those fluoroquinolone. You can't give bedaquiline. You can't give linezolid, and already you're not giving INH rifampicin. So you're very short of very medication, and it's very difficult to treat.
And sir, I think in the starting only you just differentiated between the drug-resistant TB and the normal TB.
That's right. So normal TB will be cured by the main primary drugs, INH, rifampicin, pyrazinamide, ethambutol. But any resistant to any of these, you have to modify the regimen.
Exactly. And in the very beginning of the podcast, sir, you just mentioned that it is very unfortunate that the drug resistance is rising. So I just want to know, sir, why is this happening? What is the main core reason?
See, the thing about the tuberculosis is that it's a very slow growing bacteria and it dies also very slowly.
Okay.
Hence, you have to give it for a longer duration. If you tell a patient you take this medication for 5-7 days, he will take it and he'll get it cured and that he'll be happy. But if you tell the patient that you have to take it for 6 months, so initially he's listening to you because he's sick. But as soon as he starts getting better, he said, "Oh, I'm better now. Why should I take drugs more?"
Yes.
He stops the drugs.
So is incomplete treatment one of the main reasons?
Absolutely. So one of the main reasons, I said the most common reason is incomplete treatment, because the patient stops taking the treatment as soon as he start feeling better.
Yeah.
Second cause is again because of the inappropriate dosage.
Okay.
Unfortunately, many doctors also, with due respect to them, they're giving medicine as per say whatever they on the pen, without even seeing that what's the weight of the patient. Now, that drug which is for the 30 kilogram boy or 30 kilogram of patient is not enough for a 70 kilogram of patient.
Yes.
So our TB drugs are as per the weight of the patient. So it's very important for us to know the weight of the patient. So the drugs should be given as per the weight of the patient. So appropriate dose is very important.
Yeah.
Third point is again the regimes. When to stop, when to start, what medicine, how duration is to be given. Many times the doctor will give, or maybe the patient will take the 4 drugs only for 1 month, and then they start into a continuation phase or another phase where they need a lesser amount of drugs. So these things are very important when we are treating a patient. The good counseling is very, very important. And of course, there are many other reasons. For example, patient having an HIV infection, comorbid condition, then they will tend to harbor the more of resistant TB. And then because if the patient doesn't take proper medication and he harbor a drug resistant of TB, then he will infect others also with a drug resistant bug. So there is another problem which he'll be causing to others.
And sir, do you think that lack of awareness contribute to this problem?
Unfortunately, yes. Despite now there's some like the main the metro cities and like one of the cities when I'm staying in Delhi,
Yeah.
you still have a lot of people aware of the
Yes.
problems. But the remote areas, the rural areas where the patients are not getting the
Tier
proper
2 and Tier
treatment,
3 cities.
they're not aware of the consequences of the TB. And moreover, I would say that apart from that, the rather than to get scared of the TB, it's also important to make them aware that how beautiful you can get cured of the TB.
Yeah.
So you should have to encourage those patients that once you take the proper medication, you'll be totally cured of it.
Yes.
Then certain the parents and the family, they're so scared to go to the TB hospital that
Yeah.
they go in the open, especially if they have a young daughter to take it to the hospital. They're so scared that, oh, if anyone sees it, what will happen?
Yes.
Not realizing that you give a proper treatment, she'll be totally cured of the problem.
Yes. And she will live her life freely,
Absolutely,
confidently.
as good as anyone.
Yes. So, sir, if you want to sum up the main biggest mistake TB patients make during the treatment in 30 seconds, what that would be?
I think the incomplete treatment, not taking a right dosage, is the most important thing which the patient do not take. And then many times they don't approach the physician at the right time. They try to delay their symptoms, and by the time that is already spread, it is already spread to others, and their disease also becomes so difficult. So, right timely diagnosis and treatment is the mainstay for the treatment.
Yeah. Now let's move something talking about the treatment plans. So, sir, how the treatment of drug-resistant TB different from the regular TB?
Yeah, so it's important. Like you very well, I told you before also, the four primary drugs are given as
Yes,
for
you
the
just
normal
mentioned.
tuberculosis. But when we talk about the resistance of TB, MD, or NXD, the treatment is very difficult
Is it
because
complex or longer?
both. It is
Okay.
complex as well. It's both also longer also. Many times you have to see what drug a person is resistant to, and you have to modify the disease itself.
Yes.
It used to be very long initially. You used to give it for 18 months, 24 months. But now, fortunately, we have been able to invent the new drug, which is the bedaquiline. So
Okay.
once the bedaquiline was introduced for the treatment of resistance, the duration has been shortened.
Hmm.
In fact, now the latest regime, which we call as a BPAL or BPAL-M regime,
Yes.
where the drugs are the bedaquiline, B stands for bedaquiline, PA stands for petanamide, and L stands for linezolid.
Yes.
And when you add fluoroquinolone, M is a moxifloxacin, it is a BPAL-M regime.
Okay.
With these agents, when they are added these drugs, the regime is much shorter. It's only 6 months. And not only this is reduced to 6 months, there's no injectable also. They're oral medication. Initially, when we used to give it injectable medication. Still, if the patient is resistant to BPAL, we may have to give it. So, getting injection every day is not easy for the patient.
Yeah.
You get intramuscular injection, streptomycin intramuscular injection, and you getting injection all over, and even that's become so difficult to them.
So,
But
what
now
are the
with this drug,
challenges the patient face, sir?
going and getting injection is itself is a challenge. It's not 1 or 2 days; it's for 60 days,
Yes.
and you're going to every day to some doctor or some person who can give you injection, and you're getting it done. It's painful because getting injection
Yes.
every day for 60
It's
days is painful.
very yes.
And moreover, this drug-resistant TB, the cure rate goes down. It's not as good as the normal TB cure rate. So that is again a challenge because despite giving this medication, we don't even know whether we will be able to totally eradicate the TB cure rate or not. But BPLM has definitely got a better cure rate. And again, there are challenges with BPLM also because you can't give it to the pregnant females, you can't give it to the
Oh,
people who are the children who are less than 14 years of age because
okay.
petanamide is not yet known to have no side effect among these children. You
It
can't give it
means
to these drugs. And then there are many challenges in monitoring it, especially bedaquiline. You have to monitor a lot of monitoring. You have to do the ECGs of this patient, which can cause QTC prolongation. So you have to see there's not cardiac toxicity. You have to see that their electrolytes are fine. You also have to see their liver function are fine. You have to do a lot of monitoring in these patients. But again, having said that, still it's a very good regime, and government is doing very good to spread it to the all over the India.
Sir, there must be some emotional and financial burden there as well. So, how difficult it is for the patient to stay consistent?
It's a lot of emotional burden because if you tell them someone that you got TB or tuberculosis, unfortunately, people just hear this word and they say, "Arey, kya ho gaya? What has
Yes.
happened like this?" It's just such a myth. In fact, many times when we are having the patient coming with some symptoms, we say अच्छा है ट्यूबरकुलोसिस है उसको हम ठीक कर देंगे नॉट दैट कि आपको बीमारी हो अच्छा है
Yes.
बट अगर कोई बीमारी है तो वो हो जाए तो ठीक हो सकते हैं मेनी
Yes.
टाइम पेशेंट विल कम विद अ बिग lymph node and you're thinking oh is it tuberculosis or a lymphoma or a cancer so different cancer you always say अरे TB आ जाए तो मैं ठीक कर दूंगा
Yes.
so many times tuberculosis is it's just a treatable curable disease provided you take a full course of treatment at the right time
Yeah.
so this is something which we always encourage them to take it.
When we were talking about why this is rising in India, there one point which you mentioned that was completion of medication, sir. So, why is it so critical for patients to complete the full course of medication?
See, that is for any treatment, not only for tuberculosis. Even a
Hmm.
small infection, pneumonia, or upper respiratory tract infection occurs. If you don't take a full 5 days or 7 days of course, that bug tend to become resistant to that drug. Because if you don't complete the course, the bacteria, they will again come back
Yeah.
because they have not been killed. What happened in the tuberculosis is that there's two population. One is the spotter, actively, multiplying. And the
Yeah.
other is a dormant, which will multiply in between and then they go in hiding. Multiply in between and they go in hiding. So
Yes.
you have to give it treatment for a long duration. You will kill the spotters one go, but you have to also take care of the bugs which are hidden and which will come in, after some time and they'll start multiplying. You have to kill them.
In
Many of
biology,
them
we
will
say
be
it's pseudo.
intracellular. Yeah, many of them will be within the cells, within the macrophage. So
Oh,
you need a drugs like pyrazinamide, which we can enter it and then kill it out. So what I'm saying is that these bacteria are not just present all over and then you just start killing it out. They need a longer time of
okay.
treatment. And in case you're not able to give the treatment to them, then they become resistant to that bacteria and they are converted into a drug-resistant tuberculosis.
If you want to convey to the patients, to the layman people, I just want you to please decode it in the simplest way how dangerous it can be, and in the worst case, it can take the life of that person.
Yes, so, this is a disease which is a totally curable, provided you take a treatment at the right time. But in case you're not able to take it, these
Yeah.
bacteria are going to get multiplied, and it can go each and every part of the body can be affected with the tuberculosis. It is not only the lungs which are affected; it can infect from head to toe. Tuberculosis can go to every part of the body, and once into go to the blood, and you have a miliary tuberculosis all over. You can go to a meningeal TB like brain if it enters or it enters any vital organ. You can definitely lead to mortality of the patient.
Oh,
And if you have a drug-resistant TB or XDR resistant, especially XDR,
yes.
the mortality is very high because it's not
So
a
is
curable
there a
disease.
chance of paralysis?
If it is going to involve your brain and the neurological point, definitely it can cause you the paralysis also because it can involve any part of the body.
Yeah.
If it involves the lungs, it can cause hemoptysis, the coughing of the blood, and patient can even bleed to death. If it
Oh,
causes the abdomen, it is going to cause stricture, and there will be constipation, and there will be a rupture of the abdomen, a rupture of the intestine, and it can cause to peritonitis. It can cause to infertility, sterility if it is causing a genitourinary symptom. It can cause, so any organ which is involved really get damaged by this tuberculosis.
sir, you have decades of experience into it. So there must be one case in your life which would have touched you. I just want you to please share with us in a brief.
There have been many cases actually. If I say that, really it is challenging treating them. But there was, in fact, a case, if I can remember, a young girl who just delivered a baby, and she developed a tuberculosis, and she was not being able to diagnose because during pregnancy you don't do chest X-rays, so she was getting
Yes.
all the treatments. And by the time she delivered, she got an accident. She was coughing out blood.
Okay.
And now it's very intelligent lady. Now when they came to me, and they were not staying in Delhi, they were from outside, and they for their various treatment. By the time they diagnosed it, yes, it could be tuberculosis. Now she was starting giving medicine also.
Okay.
That once she delivered a baby, they saw the X-ray and they got a sputum done. It was positive. They started it tuberculosis. Unfortunately, she had developed a MDR, or a drug-resistant tuberculosis, and she was on the normal this thing. And she was very in 20s, late 20s, so young, like I said,
very young.
delivered her first baby. So then she came to me for a second opinion, and I just started her on second line treatment. But her condition was worsening, despite started medication. Fortunately, she was resistant as an MDR, but not XDR. So we gave her all medication. She, the first 15, 20 days was really bad for her, and she was even feeding her child. I had told her. Now, again, a point if I bring it to out here, that you don't stop feeding your child if you have resistant, if you have a tuberculosis. You cover your face and treat your child. You have to protect your child also. At the same time, you even have to give an prophylaxis to the child, which is important. But now coming back to this case, she worsened, and then she couldn't even feed her child because she had lost weight, and she just was not able to have the good express breast milk also. But fortunately, she after around 40-45 days, she started, her weight stabilized. Before that, she was just falling. And she was emotionally, really shattered, and had come back to her parents' place because in-laws, she was not there. So, for whatever reason, I'm not going to more too much of personal, but she came to this thing. Fortunately, 45 days she started, then again she started improving again. And then she was totally cured. Those times BPAL was not available. She had to take it for 18 to 24 months, and she was totally cured. The good point was she didn't leave me. I mean, she didn't leave my prescription. I said, doctor, I have to take whatever you do. And she had a lot of ups, down, because the medication, there was strong medication because those times. But she was totally cured by it. So the thing which really touched by it is then she was, of course, when she cured, she went off. She was not, like I said, she was not staying in Delhi. The thing was touched me that she again came to me 3 years back with a second baby and with her husband, and they both all came with a box of sweets, and they said that whenever I had this problem, whenever there's a happiness, I always think about you. So there are the things which you really, think that yes, I've done something for there. So yeah, there have been many cases. There have been cases where patients were on ventilator and you have been able to take them out and they have been cured. Or when that was undiagnosed TB, but you just pick up, you do a bronchoscopy, you see the AFB, and then the patient suddenly starts showing improvement. So there have been many, many cases where you feel, yes, it's a good journey.
Yeah, and those memories must be very heartwarming. Whenever you recall it, you just feel like that you are just like making the existence of your on this earth and making everyone's life so beautiful to live with their family.
Yeah, we all play a part and hope that all my patients, not only my patient, all patients get cured.
Yes,
wherever they
exactly.
don't get any problems.
So now we will be just wrapping up with a very quick truth and myth segment of ours, which you just have to let us know whether it is true or false with a brief explanation, which you have already given in the whole podcast. But I want it as quick because nowadays the Gen Z people are more out of focus and they just want everything in 10 seconds. So, sir, if a TB patient feels better, they can stop medicines, false, or you can say true.
It's absolutely false. They should not stop medication until the physician tests them to do it, because feeling better is the criteria we took that the TB medication is working, but it is not a criteria that it has already worked. Let them work more. They totally get cured. Only then you stop it.
Drug resistant TB is harder to treat than normal TB. Truth or myth?
Absolutely, because you have got a resistant TB now, for which you need a modified treatment, which is not a normal treatment many a time, because you have to see what resistant drug it is to be, and the second line drugs are not as good as the first line. It has more side effects also. It is a weaker killer of the tuberculosis. So please let's stick to the treatment and listen to the physician.
Skipping doses occasionally does not affect treatment, truth or myth?
So I would say don't skip a single medication, because that is very important for us to be completely curing the disease. And however, especially for first 2 months, you don't have to skip a single. That doesn't mean you start skipping afterward. But in case and one particular day or second day, 1 or 2 days, if you get skipped, no worry. Talk to your physician. You can still be taken care of, but do not skip medication by any means, by any cost.
Completing TB treatment fully can prevent drug resistance, truth or myth?
Absolutely. If you take your treatment properly and then it wasn't a drug resistant to begin with, you're sure you will be taken care of. The medication with your TB will be killed, and you will not develop a MDR or a drug resistant TB in future. You will be totally cured of the disease.
My last question would be, sir, TB work differently on female and male, truth or myth?
No, TB is as bad or as good at whether it's a male or female. It doesn't, it doesn't matter whether it is a male who's suffering from TB or a female who's suffering from TB. The medication remains same. The problem is same. The TB medicine, bacteria causes the same problem in the all, irrespective of which sex you are. So that you have to take the same duration of the treatment when you're taking it out. Of course, when it is among the female, if the patient is pregnant, you have to be careful about that, because, and again, if I may add to it, TB medication is absolutely safe. The HRZ is absolutely safe if the patient is pregnant at that time. However, if the female is not pregnant and is newlywed, we'd always tell them to avoid going for a pregnancy, but till the treatment is cured. But if the patient is already pregnant, we don't tell them to terminate pregnancy. They can carry on the medication.
Thank you so much, sir, for bursting the myths and telling the truth out of all the things which people resist and keep it in their mind, and which makes this worse in the awareness. So it was a great important side from your side. So as we have learned, tuberculosis is curable, but only when the treatment is followed properly. The biggest takeaway from today's conversation is very clear. Stopping treatment early or skipping medicines can lead to dangerous drug resistant TB, which means harder to treat, but yes, it is curable. Awareness, discipline, and proper medication guidance by your consultant are key to winning the fight against tuberculosis. Thank you for joining us today. We hope this conversation helps spread awareness and encourage patients to complete their treatment responsibly and live their life freely with their loved ones. Thank you so much, sir.
Thank you.